All of a sudden, one of the patients was like, "Oh my gosh, like I'm feeling a lot of pain and I feel like I'm going to throw up and all this stuff." And all of a sudden, I was like, "Oh my gosh, my vision is going like this." I don't think that med students hear that enough, that someone's proud of them, because this whole process is really difficult and can make you feel pretty small.
Hello, everyone, and welcome to the Med School Years podcast. I'm Dina, along with my colleague Carlos.
Hello.
And today we are interviewing Nicole, who is a medical student at the Warren Alpert Medical School at Brown University, which is where I used to work. So Nicole and I go way back, and I'm super excited to have her here today. So thank you so much for being here today.
Thank you for having me. I'm really excited to be here.
Welcome. You're welcome. So talk to me a little bit about what the experience has been like. You're now entering M3, correct?
Yes, I've gone through 3 clerkships so far of my 3rd year.
Wow.
So
And what has that been like?
it's been a really crazy transition, honestly. Not really what I expected, but I think in the best way possible. I've been studying so much, and it's been such a great opportunity to finally apply everything that I've learned and actually interact with patients, which is why I came to medical school in the first place, was to connect with people and create safe spaces for people. So I'm really excited.
What do you mean when you say not what you expected? I think Carlos is probably going to ask the same thing.
I think there's no really way to anticipate what clerkships are going to be like, just based off of shadowing experiences and like working in the clinical setting, but not really being like technically part of the clinical team until you're actually like presenting patients and interviewing patients, and you're actually like doing the work that provides for the patient themselves. And so there's no way of simulating that until you're actually in that environment.
So what clerkships have you done? Yeah. What clerkships have you done?
So I started off with OBGYN, and then I did pediatrics, and then I had an elective in interventional radiology. So I've been all over the place. But the introduction was really nice. It was like the beginning of life and then leading up to the age of 18. So it was a nice introduction. I feel like everyone should have that kind of way to start.
A nice trajectory.
Yeah, exactly.
I'm all about reflection. What are the 3 highlights from what is a highlight from each sort of clerkship, and what is one challenge or something that you're like, I wasn't anticipating that in this clerkship? If you could tell us a little bit about that.
Yeah, so I went into med school thinking that I was going to be a surgeon. I love neuroscience, and I was like, you know what, I'm just going to go for it. I'm going to be a neurosurgeon. This is what I've always dreamed of doing. And that had been my path for a really long time. And then I came to medical school and almost immediately realized I'm not a surgery person. This is not my calling. I'm much more into medicine, or like the medical side of the surgery versus medicine, and realized that I love pediatrics and love working with kids and adolescents. So I really did a 180. But as far as highlights go, OBGYN was just an incredible experience of being a part of supporting people who are giving birth. Like literal life is starting in your hands. That is just, I can't even describe that in any way, honestly. It's such a unique experience that only people who are giving birth get to experience, and then providers get to experience as well. But other than that, like on a daily basis, I try and describe it to other people who are outside the medical field, and it doesn't translate at all. So that was really cool. And just like doing that on a daily basis. Oh yeah, like I was in the OR there was one day where I was in the OR for 8 C-sections, which was crazy.
Oh my gosh.
It was a crazy day for them, but just trying to describe that to anyone else, it doesn't make sense. So that was really cool. I think the challenge of OBGYN for me was being in the OR and being around people who are still awake and in pain and feeling pain and pressure during surgery. And like, I think I didn't anticipate that, honestly, until I was in the OR, and all of a sudden one of the patients was like, "Oh my gosh, like I'm feeling a lot of pain and I feel like I'm going to throw up and all this stuff." And all of a sudden I was like, "Oh my gosh, my vision is going like this." So yeah, that was something that I didn't anticipate.
It's like when you go to the doctor, like you're not supposed to feel anything. You're like, but I do feel something.
Yeah, exactly. Like, the
Wow.
pain isn't there, but you still have pressure because it's 2 different
Yeah.
neural pathways that are
Yeah.
acting. So, they block the pain side, but they don't block the pressure side, and a lot of people experience pressure as pain in the same way. So, yeah, that was definitely interesting and something I didn't anticipate when I almost passed out in the OR.
Oh my god, that's crazy. That's crazy. Doesn't Brown have a new program where I read an article like where now all med students have to spend 4 hours in OBGYN? It's
Oh, I didn't know about that.
yeah, it was a med
We do have
student
a
who like started
deliver a
this.
baby week, yeah.
Yes, that's what it is.
So a lot of
Deliver a baby
students
week. Yes.
yeah, a lot of students do that. I didn't have the opportunity to do that last year. So this was
I think that that's
my first
fantastic to
experience. Yeah.
give students exposure, even if you're not interested in OBGYN. Yeah, I think
Yeah.
just being in that moment and understanding again, like how pain can show in different ways and also just like how people come into the world, I think is so exciting.
Yeah. A
You said,
really unique experience.
and I can totally see you doing that, by the way. You said surgery is not your calling, but you entered med school and before med school wanting to be a surgeon. Tell me about where that came from and that interest came from and how that when that aha moment happened. I mean, you said that you wanted to be present with people and connect, but were you super excited to enter an OR and then you were just like, "Oh my gosh, like this is like a light went off. Like this is not for me."
Yeah, I think it was over the course of it was over time where this all happened. I don't think it was like one specific aha moment. Although I have had a couple aha moments when I'm with pediatric patients where all of a sudden I come out of
Mm,
a room and I feel this sense of just so much gratitude and joy and appreciation to connect with young patients and be a part of their care. I think that's so important. And I did have one experience like that, where I was with a patient who was part of our gender and sexuality health clinic at Hasbro, and they had just come out as trans, and I was in the room for that. And they hadn't told anyone, and I was like the first person that they told, like a provider, aside from their
oh
friends.
my
They hadn't
god.
told their family. And I was like, "Oh my gosh, this is so incredible." And then I leave the room and I immediately am like, "Oh my god, I need to go to the bathroom and cry because this is just like such an incredible, wonderful, beautiful experience to be a part of." And I feel like it's such a privilege to be a part of that experience and to be trusted with that information and to be able to connect with patients to make them feel like they can trust you with that information. So,
It's important.
yeah, I think the interest in surgery been for a long time. My father is an orthopedic surgeon, so I grew up like following him around the hospital as he was like checking in on patients. They would always see, oh, there's little Nicole, like following Dr. Hinz around everywhere.
Mm,
So I think everyone always knew that I was going to be a doctor, and I had some really great interactions and some great mentors who are neurosurgeons. Some really incredible female neurosurgeons who I think have done wonders for the specialty itself and have really changed the way the specialty works, particularly in Central Oregon for sure. And so I think that kind of pushed me in that direction. And then I got to medical school and realized I want to spend more time talking to patients and I want that to be my priority because I really enjoy the connection and I don't
that's
want them to be
awesome.
asleep for the majority of the time that I'm with them. Yeah.
Thank you.
Yeah, thank you for sharing a little bit of the emotional side of medicine or the vulnerability that patients have with you as a medical student and with physicians. And I think that's something that we continue to emphasize as we're looking at personal statements and secondaries, the importance of that reflection and being human and staying true that you are first and foremost a human right before the profession comes along. So thank you for sharing that. I think looking back, you're a third year now. What are some of those sort of emotional, maybe more vulnerable moments during your first and second year in med school? And what sort of have you learned and taken with you as you navigate the intricacies of clerkships?
That's a great question. I think medical school is so difficult and it's so challenging for a variety of reasons. And it's so hard to explain to anyone outside the medical field because
Hmm.
it's this little microcosm of so much information is being thrown at you that you have to digest and understand and apply and connect with patients and also at the same time develop interpersonal skills and practical like hand manual skills as well. So I think there are so many challenges, and I've learned to give myself a lot of grace through the process. And I think that has really helped me a lot. I think it's easier said than done. But I think I started off being really intense because of the way that pre-med is set up, which is uber competitive and
Mhm.
isolatory, and you're like in these silos and separated from students, and you're not really allowed to interact because you're competing against each other to get into the same spots in medical school. And then you get to medical school, and all of a sudden it's not you're competing against each other, but you need to work as a team because medicine is a team career, it's a team sport, and no one's taught that skill in college. So it's very different, but I think, yeah, giving myself grace, and then also what I tend to remind myself too of a lot is people do this, this happens, there are other students who do this, I can do this, and I will continue to succeed because this isn't the end. Like I will become a doctor. It's not if, it's when. So I think those are some of the things that I've learned.
Thank you for sharing that. And you're right. I think a lot of things you are not directly learned through your undergraduate years or graduate program. But you bring up a good point about teamwork, and it's not something that you go to a class and say, this is how you do teamwork.
Yeah.
At Brown, I'm not from Brown. I know Dina had worked there. What has Brown given you to develop that skill as a medical student? Again, you're not competing anymore. You made it. So that's the first step.
Yeah.
Joke aside, it's going to happen again in about a year for you. You're going to be up and competing
Yeah.
again, right? But what has Brown that's unique about that environment has prepared you to work as a team?
Yeah, I think we do. There's a lot of intention behind working in small groups, learning in small groups, meeting students, and we all know each other. There's 140 of us, but we all know each other. We're all familiar with each other. Everyone knows each other's name, where we're from. Like we're all very close. And every single person who shows up on my schedule for clerkship, it doesn't matter who they are. When I read their name, I'm like, great, I get to work with this person. I'm so excited to see them in the hospital and see them like work in a clinical team and work with them clinically now that we have all this knowledge built up. So I think Brown does a great job of doing that and making us all feel familiar and comfortable with each other. I think I learned a lot about teamwork through my master's program at Brown, which was the Gateways to Medicine program.
Yes.
It's a really small program. It's only about 35 to 40 students, and it completely shifted the way that I think about medicine and about working as a team and about being a leader and what a leader means when you're working in a team. So I think that was an incredible experience, and I'm still very close with a lot of my peers from that program because of the way that we bonded and we connected through collaboration and working with each other to succeed academically and professionally.
That was going to be my next question, actually. So perfect timing. You mentioned how it was really competitive as a pre-med and undergrad for everyone watching. You went to Barnard for undergrad. And then there was this in between, right? Where you completed your master's in medical sciences. I happened to be there at the same time that you were, which was amazing. And you were a student who just checked the box. Like, I'm just going to get the master's in medical sciences so it can help me get into med school and move on with my life. You formed like amazing relationships and friendships with students in that program in the gap year, in the time that you took while you were waiting, because you had one gap year, right? You were a TA for the program. You gave back in so many ways. And I think that's so important because you really did. I feel like you went from that isolated like silo, like you said, about in that pre-med competitive world in undergrad, and then you did a 180 in this program. And just talk a little bit about like how important it was for you to give back to the program and return as a TA and even mentor a lot of other students who were in the same shoes that you were in.
Yeah, I think I continue to say this to this day. That was the best decision that I made academically and professionally and personally. I grew in so many different ways from that single year. It was the most intense, academically challenging year I've ever experienced. First year of med school,
It's
a
fast.
breeze after that. Second year of med school was still more manageable than the Gateways program was, just because of the intensity of the program itself. But I think I learned so much from that year, and I think I really took to heart when an alumni came at the beginning of the year and said, "You get what you put you get what you," and I try to apply that to
Absolutely.
every single interaction that I have, especially with mentors and with attendings and residents. I always try to apply that. I'm going to get out of what I put into this interaction. If I just want this to be an acquaintance, then it's not going to go anywhere and I'm not going to learn anything. But if I approach the situation as if maybe they're going to be interviewing me in 2 years for residency, or maybe they could be a mentor for life, or maybe they could just be someone who is like a personal friend and a colleague that I can call on in 10 years from now and say, hey, I have this patient and I'm looking for some follow up or whatever the case may be. So I really took that to heart when that alumni said that at the beginning of the year, and I applied that to that program. And I'm so glad I did because I learned how to study correctly, well, not correctly, but efficiently,
In a different way.
in a different way that
Yeah.
just really didn't work for me in college and wasn't going to work for me in medical school. So I just said, I'm going to wipe the board clean. I'm going to start over. I'm going to apply everything that I'm being told. I worked with a learning specialist at Brown, who there's like a team of them now. They're so incredible. They know so much about learning and about studying. And so I took that to heart and I met with them quite a bit. And yeah, I decided to really just commit myself to doing as much as I could. And I got so much out of it. And there was so much, I have so much gratitude for that program. I learned so much. I grew so much as an individual. I became really confident in myself professionally. And I remember just reflecting back from that year, walking into a patient's room at the end of the year versus at the beginning of the year and how different I felt. Whereas at the beginning of the year, I was, hi, I'm Nicole, I'm a student. And now I walk into the room and I'm like, no, I'm here. I belong here. This is who I am.
Not as much
Like I'm
imposter syndrome.
yeah, not as much imposter syndrome. So yeah, I think I learned so much and all the people in that program are so incredible. I have so many great mentors from that program too. And all the students who come through are such hardworking, dedicated, kind, empathetic, compassionate people who really want to make a difference in the medical field because there's so many different aspects of that program. It's not just about academics, it's about impacting the Providence community and the greater Rhode Island community and doing research and building clinical skills. So yeah, every single year I try and participate as much as I can with reunions and with introducing new students to the program and making them feel welcome. And we just welcomed our next cohort of students, so I was on a call with them about a week ago and met all of them through that and answered some questions. And but yeah, I don't know if I'll be able to tutor this year just given the
Your
busyness of
schedule.
clerkships, but I'm gonna do as much as I
Yeah,
can. I try and show up just for a couple lectures here and there, just so that they know who I am, and I don't know, I think it makes things easier. Medicine is a team sport, so you don't get through it alone.
it is.
Yeah.
Thank you for sharing all of that. I think we talk to a lot of students who question, is an SMP right for me? Because the Gateways program is a special master's program. And I think you get so much out of it. If you're a student who doesn't want to work, it's not for you because, like you said, it's so much work. It's the M1 curriculum. But
Yes.
if you feel like you need something like that to bolster your application, I think it's been life changing for so many students. Thank you for sharing all of that positive
Yeah.
feedback.
Yeah.
So you talked a lot about some of the things that you did in the master's program, and you talked a little bit about the things that you're doing now. What else have you carried over or expanded, shrunk, said it's time for me to move on because I'm doing this? Because I
Yeah.
imagine that you're a busy individual now.
Yeah, I am pretty busy. I love being busy though. It keeps me sane and keeps me happy, which I think a lot of medical students can relate to that. I think we function well under a little bit of chaos. But I think I have continued to do a lot of tutoring and a lot of mentoring and working with adolescents and young adults. I've done some teaching for a couple of different programs through Brown and then just outside of Brown in like local high schools and stuff like that. I've also worked with some street outreach programs, and then also working through some housing for queer youth, which is something that's really important to me in Providence. So I've tried to stay connected to the Providence community a lot. That's something that's really important to Brown as well. But yeah, I've had to take a step back from a lot of that this past year. So it's been difficult, but because there are so many things that are so important to me, and medicine is just one aspect of that. And so removing all those things is, I don't know, it feels strange, but I know eventually that I'll be able to branch back out and do all those things again.
Thank you for that. I'm going to go back a little bit to when you applied to medical school. And I love your story because I'm sure at the time you didn't love your story, but you applied and you were waitlisted at Brown and a number of other schools. And you were at that cusp of the new cycle starting, right? So primaries are opening again and you're still waitlisted. And you ended up having, and for students watching, you don't want to miss that window of opportunity. You don't want to be a late
Yeah.
applicant. So you applied again while you were waiting to get off the wait list. But it happened. And I think for so many students, they think it's not going to happen. I'm not going to get off the wait list. I can't believe I have to reapply at the same time. And I always try to say, this is just like your job right now. Like it's a window of opportunity. You have to get it done. It doesn't mean you're not going to get off the wait list, but it's a super stressful few months. Talk to me
Yeah.
a little bit about what that was like, and then what it was like to finally, I remember when you got off the wait list, it was like classes start in 4 days, by the way. It was crazy. It
Yeah.
was so crazy. Tell us a little bit about that time of your life.
Yeah, I would say that year applying to medical school and then having to make the decision to reapply was really tough. And thankfully, I had so much support around me, but it can be very disappointing and
Mm.
frustrating and make you feel like you aren't worthy of getting into medical school, you aren't worthy of being a doctor. And one of my friends who was really close to me, not in the medical field, kept saying to me, it's not if, it's when. And I think I've said that before, but I always say
Yeah.
that to new students now. It's not if, it's when. Because if you are committed to being a doctor, it will happen. And this is a crazy process applying to medical school.
So crazy.
It's a ridiculous process, but it will happen if that's what you want to do. It will happen, and you'll find a way to make it happen. And what I that's what I decided to do. I met with one of my mentors at the end of the application cycle, my first application cycle. I was on the wait list at 2 or 3 schools, but the window was closing. They were about to start school. I'd gotten email saying that this probably isn't going to happen for you. And so I'd given up. And so, yeah, it was a difficult decision, but like you said, it's a window of opportunity. You have to get it done. And so I rewrote my essay, I rewrote my secondaries, which was really difficult. I had a year, but it wasn't like a year of gateways. It was the gateways program. It was a
It
year of
wasn't
reading.
like a year of planning and prepping and writing. Like
Exactly.
you
Yeah.
crammed it all into a month.
Yeah. Exactly. So it was very intense, and at the time, my sister was also applying to medical school, so we were sitting together
Oh my
writing
gosh.
secondaries on vacation, and I'm sitting around a table with my entire family, and I get a call from a 401 number that is, like, unknown,
Rhode
and
Island, by the
my
way. For those of you
yeah,
watching, so one
it's
area
Rhode
code in
Island.
Rhode Island, it's
There's
401.
one area code.
Small state, one code.
And I look at it and I just, okay, I'm not gonna answer. My mom's, you should probably just answer that, like, just in case. And I pick up, and the director of the program at Brown answers, and I look at my mom and I go, oh my God, this is them. And my mom starts sobbing, and then my grandma starts sobbing, and
Oh,
my dad starts sobbing, and everyone around me's crying. And the director's, are you okay? But so
you
yeah,
landed, you were
incredible
meant to
moment.
be. You
Exactly.
really
Yeah.
did. You really
Yeah.
did.
But it was really like I was about to move to Spain for a year, and I had all my plans. I had a visa, I had everything. I was gonna move with my brother. We already had jobs, we had an apartment, we were ready to move,
It's crazy.
and they said, "We need you, and if you wanna come, it starts in 5 days." And so I dropped everything and released my apartment, and thankfully, I already had an apartment in Providence. So I ended up staying, and yeah, it took a while, I think, to remind myself that I still belonged because it feels pretty demoralizing to be placed on the wait list.
It does, and it does, and a lot of students don't realize,
Yeah,
but that's the business of admissions, and not just med school
exactly.
admissions, undergrad
Yeah,
admissions, law school admissions. It's the
yeah,
business of admissions, and on that side, it's very removed from students. It just is.
yeah,
You're
yeah,
filling seats, there's a lot of turnover, you have a lot
yeah,
of goals, but it's a personal experience for the students on
yeah.
the other side of it.
And
I
it's
mean, you're
hard
not
to
enough.
internalize it. Yeah, exactly. It's hard
Yeah.
not to internalize that. Yeah, internalize that and turn it into, oh, this is a personal thing against me, and maybe I don't deserve to be here. So it was definitely a whirlwind starting medical school.
So crazy.
Yeah.
I've had to make calls like that, and we pulled somebody off a wait list on a Friday. Class started Monday, so they had
Wow.
36 hours to relocate to a different state. The person made it happen. I think he is now a physician, and I've not kept track of him, so he's out there somewhere. But I remember making that call, and he was so happy. So it happens, right? But then you have to make
Yeah.
that split decision of I gotta move.
Yeah.
Staying on this theme, I'm curious because you said you were planning to go work in Spain and move and all of that. What was the plan there? Like, what were you trying to demonstrate, fill the gap with? What was the goal?
Yeah, I think I did a year of research, did a lot of work in research, had some papers. So I felt like my clinical experience had been filled, my research experience had been filled. And I'd just gone on this wonderful trip with my brother, and we came back and we both looked at each other and said, "What are you doing next year?" And I think it was just like a moment of there's a huge part of me, like I said, like we have these so many different interests and passions. Part of me is to travel and to experience the world, and I speak Spanish as well, and I'd studied abroad in Spain, and I really wanted to go back and live there longer, and I think that's still a goal for me, but maybe after I retire, I'll end up there eventually. So it just ended up being a different path. But yeah, I think it wasn't as much a decision for my application as it was like a personal decision for me. This is what's gonna make me happy. I have a limited amount of time before I do eventually start medical school because I know eventually I will get in and I will end up being a doctor. But this is what I want to do with my time, and this is what will bring me joy and excitement. And I think whenever you make a decision like that, it always has a positive impact. And I knew that when I reapplied, my application would change and my essay would be different because I'd have all these wonderful experiences in a different country.
So, did your brother end up going? You're like, bye, I'm going to
So
medical school.
ironically, he is living in Spain now for a different reason. He
Oh,
ended up marrying someone who is from
oh my
Spain. So now
gosh.
he lives in Spain. Yes. So I have many reasons to visit Spain now.
Awesome.
So yeah.
That's amazing. That's amazing. Nicole, what did you talk so much about like the empathetic side of medicine, right? With teenagers and with children and with women. What is something that surprised you the most about medicine that you don't feel like a majority of people are aware of?
That's a great question. I think what people aren't aware of is we have so many interactions in one day, and our interaction
Mm,
with an individual patient is everything to them. But for us,
it is.
it can't be everything. As much as I want it to be everything and I want to be fully present in the room and take everything in and do as much as I can and give at my all to that one interaction and that one experience for that patient, it can't be because then I leave the room and I have to go to the next patient. And as a med student, I'm only seeing a handful of patients, right? But then as an attending or a resident, I'm going to be seeing even more patients. And so that amount of energy, I always say there's only a certain amount of spoons you have left. And I can only give my spoons to like a standard group of people. And after I use up those spoons, I have to have time to renew myself, right? And so people go into the exam room scared and vulnerable and in pain and not knowing what to expect. And so that interaction is so heightened and is so personal. But for healthcare providers, it can't be because we just there's only so much energy we can put into every experience. And so I think that's something that I realized going from one patient who was actively dying to the next patient who was going to be discharged. And how do you leave one room that is just takes everything in you to go to the next room and put a smile on your face and say, I'm so
It's
happy for
hard,
you. Yeah, I'm so happy for you.
really hard.
You're recovering. This is what you need to do. Now you're going to leave the hospital. And now this is behind you, or hopefully behind you. I think about that a lot. And I don't think it's easy. It's still something that I struggle with a lot too.
Staying on this theme, now that you're in clerkships and seeing patients, you've disclosed to us that you have an interest in pediatrics, which is good. You're discovering who you are, right? What you want, what you see yourself doing down the road. Tell us a little bit, what are you doing now to prepare for that next stage? You have to go through a whole application process again. This is not over, unfortunately. But what are you doing now to prepare for that next step in your journey?
Yeah, so I think we were given a lot of advice going into third year because it is such a huge transition. It's like you've been studying all your life, and now all of a sudden you're actually in the medical field, and that's where you are 100% of the time, and you're using the knowledge that you've learned to hopefully apply it to healthcare. But so we were given a lot of advice. One of the main things that I really took to heart was focus on each clerkship and every shelf exam and every interaction as much as you can. Every attending, every resident, they're going to be providing feedback on your efficacy, your efficiency, the way you interact with patients, your professionalism. So just keep that in mind and take it one day at a time and really try and be present. So that's what I focused on, because if I start to look too far down the road, then I lose sight of what's going on like in the moment. And then that's when careless mistakes are made, or that's when I don't give 100% of myself to a patient interaction. And then I don't know, then it ends up not being a good representation of who I am, I think. So I think just like focusing on individual clerkships, trying to study every day, trying to stay balanced as much as I can, trying to sleep when I can, trying to eat when I can, and just focus on one day at a time, one clerkship at a time. Because shelf exams are a completely different beast than didactic exams. And we have OSCEs and we have all these evaluations that will now be put on our residency application. So, yeah, I think just taking it one day at a time and asking for feedback whenever possible, I think is so important, and really trying to take that to heart.
Thank you for that. You said eat when you can, eat when you can, sleep when you can. How have you maintained your wellness throughout medical school and throughout that really intense year prior to that in your master's program? Like, what do you do to make sure, that while you're taking care and handing out the spoons, right, to all these other people, you're also taking care of Nicole?
Yeah, I think that's something that I'm working on actively. I wasn't anticipating the huge change in my priorities and the schedule change that would happen with clerkships. And so I'm rebounding and trying to react and be proactive about these next clerkships that I'm going into. My next one is surgery. So I'm trying to set up a good schedule and be prepared for what will inevitably be exhausting,
Mm.
but trying to find time for myself. I think the first thing that I always say to other incoming students is, if you can, find a therapist or a counselor or someone you feel comfortable talking to. Even if it's like through the med school, we have a great counselor at Brown who's incredible as well. So I think finding a therapist is super important, especially just someone who is in the medical field, because they can help talk you through those difficult scenarios and the difficult situations that we're put into that you can't really talk about with anyone else outside the medical field, because it's just so different and it's so personal. So I think therapist, spending time for yourself. I try and take walks as much as I can just in the park. I gave up on running every day. I did that during didactics, and it's exhausting being in clerkship, so I just decided I'm just gonna walk every day, and that's gonna be my little
Walking
bit
is
of
great.
exercise. Yeah, and I it's very meditative too,
It
and I
is.
think that's so important, like, finding a little bit of time to be intentional with your body and with your time and the space you're in, And so I think that's been what's good for me, but I don't know. I know a lot of other people like bike everywhere or my best friend does yoga. She does hot yoga and that's really meditative for her. So I think like finding that time to reflect and yeah, work through a lot of things that are happening on a daily basis. I do journal quite a bit. I took advice from one physician who said that she has like a jar of notes from like different patient interactions and just like reflection, keeps them in a jar. And then whenever she loses a patient, she picks a new rock that she feels like represents that patient. So I picked that up as well. And thankfully, there aren't that many rocks that I have at this point, but that's something that I've picked up too is like
Oh,
keeping a little jar of rocks for patients who are no longer here. And I think that's a good way
I
to
love that.
reflect and honor patients moving forward.
So
Beautiful.
as we end our time with you, I'm fascinated by you for a couple of reasons. We usually end this I like to end this podcast, right, as people view this with a moment of reflection, something a bit of knowledge to share with those that are interested in pursuing medicine, that are in medical school, probably struggling for a second year, you're now in your third year. But I think through this entire conversation, and I'm going to say this to you because I wrote this stuff down. You were talking about I was debating whether I was going to be a surgeon or a doctor. I could totally see you as a pediatrician. And I wrote
Oh,
down a
thank
couple
you.
things of like, you're so reflective in like everything that you do. There is an intentive reflection of it.
Intentional.
Yeah, like you do something and then you look back and you're like, I know why I did it. You're also very empathetic. I feel you have this nurturing and you care. You were talking about the patient as I feel pressure, it's pain. And you yourself were like you were feeling for the patient at the moment. And I think you're so insightful. I think you have a
Very.
way of looking at yourself and saying, I know what I can do and I know what I cannot do at the moment. And I have to figure this out for myself. But I just wanted to share that with you. Like I wrote these things down because I'm like, this as an individual, I'm like, yeah, I don't see this person as the surgeon because you made a really good point. I want to be there with my patients, right? I want to see them. I
Yeah.
want to hear from them. As a surgeon, more than likely you're like, okay, I'm here and then good night, go to sleep, and then you wake up and then I see you. But you truly have some of the characteristics that I would feel comfortable if I was a child or just general person seeking a physician.
Thank
I would
you.
want and my doctor. So I think you yourself are discovering that, and that's good for you. Anyway, I just wanted to mention that to you. But as we
Thank you.
truly end this time with you, what's one piece of information outside of the multiple things that you've told us that you would say to anybody that maybe is in the moment of I'm applying to med school or I am in med school and I need a little bit of encouragement at this moment?
I think, I don't know, I always go back to what I would want to hear. And something that I would want to hear would be, you're worthy and I'm proud of you for all the work that you're doing. I don't think that med students hear that enough, that someone's proud of them. And because this whole process is really difficult and can make you feel pretty small. So I think just, yeah, you're worthy and you deserve to be here. And the fact that you care means that you're going to be a great physician.
I love that. And I love
Yeah.
what Carlos said too. You really are. What I love about you, Nicole, is you're always present. You're very in tune, just like Carlos said. Like it's a gift. It really is a gift, and it's going to
No,
make you
thank
an
you.
amazing physician. So
Thank
congratulations on
you.
everything you've
Thank you
done.
so much. Thank you.
Thank you. Thank you for sharing time with us. Thank you for being open, honest, sharing your view of what medical school is. And I think we look forward to see what is going to happen to you in the future, whether
Yes.
it is pediatrics or if it's something completely different as you continue your journey of exploring the clerkships and the clinical world. We wish you the best. We'll keep an
Thank
eye out
you.
for you. Keep us posted. See what
I will
happens.
for sure.
We're
Thank
here.
you so much. Thank you
You're
both.
welcome.
Thank you.